Let's bring in NBC senior medical correspondent, Dr. John Torres. Dr. Torres, good morning to you. As Kathy mentioned, that new poll finds about 2/3 of parents are hesitant to get their kids the shot. What is your advice to alleviate some of their concerns?
And Joe, you're right. There is that hesitancy to get the shot, and it's a hesitancy that parents typically have because they're very protective of their child. A couple of things I tell them is, one, from a community perspective, children right now are 25% of the cases that are out there. That's from a community perspective, but parents are more worried about their own child. So here are some numbers for their child. Last week, 118,000 children ended up with Pfizer. Since the pandemic, over 8,000 have been hospitalized, a third of those in the ICU, and unfortunately, there have been 146,000 deaths, which according to the American Academy of Pediatrics, puts COVID now in the top 10 causes of death for children. And so I would say, look at those stats because it's important to understand that if your child gets COVID, that could be devastating with lifelong consequences. And so the vaccine itself proven to be very safe in the trials. The trials looked at them extensively for months. There were no side effects, and we know side effects occur in the first couple of months. And so that long-term concern is very theoretical, and if it happens, could be very rare at the most. But side effects from COVID itself could be devastating. So again, Joe, the main thing is look at what could happen if your child gets COVID versus look at the vaccine itself, which we know is safe and effective.
Dr. Torres, to that very point, there was a new study by the CDC on Friday that effectively showed that the vaccine offers more protection than antibodies that you would get from getting COVID. What can you tell us about that?
And Kristen, this answers that question that a lot of people have about natural immunity. If I have COVID, am I protected? And it turns out not as well as if you get the vaccine. As a matter of fact, they looked at 7,000 people in a variety of states around the country who had COVID, recovered, and ended up getting COVID again and hospitalized versus those who got vaccinated and had breakthrough infections. You were over 5 times more likely to have COVID if you had natural immunity and had not gotten vaccinated. So that vaccine is giving you much more protection than COVID itself. So this is answering that question that a lot of people have had.
Dr. Torres, quickly on this last one, Halloween is on Sunday. Is it safe to take the kiddos trick-or-treating?
This year is a great year to take them trick-or-treating. Experts, I want them to go out trick-or-treating. Just be safe like you normally would for Halloween. But this one, take some hand sanitizer. If you're in a car with other friends, keep the windows down. If you're handing out candy, have hand sanitizer. Sanitize your hands before you give them the candy. And of course, kids, have a lot of fun, but wait till you get home with that candy so your parents can look through it, make sure it's all safe, and just give you the amounts that you need to eat because you don't want to eat the whole bag.
Good advice. Good advice for many reasons. Dr. Torres, thanks so much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.